Hi viewers, welcome back. In today's video, we are going to discuss about the nursing profession. Okay, so nursing, nursing as a whole. Okay, but in nursing, we have many categories. So today we will discuss about these categories or the different courses in nursing in detail. Okay, so first is general nursing and midwifery, that is diploma in nursing, that is DGNM also we say, it is diploma in general nursing and midwifery. It is a 3 years course which consists of both the theory and the practical. Okay, so you will be discussing like in this 3-year course you have all the subjects inside. Okay, so you start from anatomy, physiology with all your specialty subjects in the nursing with the clinical requirements. Okay, so the clinical requirement will be formulated by the INC. Okay, they will give you how many hours of theory and the practical hours that is to be fulfilled, and your college or the education institution where you are studying, they will be taking care like how many hours are getting completed with theory and practical. So you will be doing your practical as well as your theories in the general nursing and midwifery. So then comes the post basic diploma specialty programs. So what is this post basic specialty program? So after your GNM you can do specialty courses. Okay, so specialty courses in the sense they are like 1 year programs that is available, that is like either you can go in for critical care nursing and ICU technicians, then lab technicians and dialysis, and like you have many courses, that is like diploma courses available, and like once you finish your DGNM you can go in for this specialty courses. So that we call as post basic diploma specialty program. Okay, so then we have the Bachelor of Nursing or the BSc Nursing program. So actually when this BSc Nursing program started, it was a 5 years course. So what happens in this 5 years, like 3 years you will be detail you will be studying about these subjects. Okay, so that is like same like about your anatomy, physiology from the beginning. You go in detail with your medical, surgical, pediatrics, and all these subjects wise you will go. And then 2 years like you will be having clinical exposure. Then this program came down into 4.5 years, like where you will be studying nursing for 4 years, and then half, that is like 6 months you will go in for an internship program. Then again the syllabus was revised, and then we have 4 years courses for BSc nursing. Okay, so now at present what is existing is we have 4 years Bachelor of Nursing course. Okay, so here again you will be having all these subjects. Okay, so from the beginnings, from the basic things you start, that is from fundamental of nursing in the first year, then you go to medical surgical nursing, then your specialty programs of community pediatrics and OG will come the final year. Okay, so that is with your Bachelor of Nursing. So in the beginning it was like in semesters they used to write exams, now they are writing like per year they will be writing exams, and like again it differs with the universities. Okay, so sometimes it is like your Dr. MGR Medical University, like we have yearly once exam, and it depends upon, sometimes when you go to Rajiv Gandhi University it differs, sometimes it is like deemed universities it differs. Okay, so it is according to the educational institutions where you study, this course will differ, that is like the program or the exam schedule will differ, otherwise the course is going to be the same for 4 years, that is your Bachelor of Nursing course. Then comes your post basic BSc nursing program. So this is nothing but your like your next degree, that is your degree of your GNM course. So once you finish your diploma in nursing, in case if you want to get upgraded, or otherwise like in case if you want to go in for a degree program, at that time you will go in for post basic BSc nursing. Okay, so again the syllabus is formulated in such a way that like you cover all the areas, that is like your basic fundamentals, that is like very less portion, because like already 3 years you have studied this GNM course. So where you will be having a limited amount of your fundamentals, that is like your basic procedures of nursing care, that will be reduced, and concentration will be there on the other specialty areas and your clinical practices. Okay, so that is with your post basic BSc program. And then comes the masters in nursing, so that is your MSc nursing program. So what we do in this MSc nursing program, we have 5 specialities in MSc, that is your Master of Nursing program. So that is your medical surgical, pediatrics, community health nursing, mental health nursing, obstetrical and gynecological nursing. So accordingly you will be having like syllabus based upon that. Okay, so what are we going to do in this Masters of Nursing? Your BSc nursing program, whatever you have studied in your BSc nursing program, this is an in detailed program. So you are going to study in detail about the subject. So in case if you are going to study about pediatrics, that is like child health nursing, MSc in child health nursing it comes, and like when you are going to study pediatrics, you will be studying pediatrics in detail. Suppose for your BSc program, it was like for 6 months you will be studying this pediatrics, but now what will happen is like you are going to study for 2 years. So in detail about the conditions, you will be studying the management, the medical management, the nursing management, everything you will be studying in detail. Okay, so that is your MSc, where you will have it in 5 specialty regions. And then comes the advanced programs. Advanced programs, you have 2 areas of advanced programs. One is your MPhil and one is your PhD program. So MPhil, what is MPhil? So MPhil is like, in case if you are doing as a regular course, you will be doing it for 1 year, and in case if you are doing it as a part time, you will be doing it for 2 years. Okay, so it is again your masters in philosophy, that is like in nursing when you do, it is MPhil in nursing you get. And then comes the PhD program. So PhD program is your doctorate in nursing. Okay, so you can specify as doctor so and so once you finish your PhD nursing course. Okay, so PhD, again you can do PhD as a regular course or otherwise as a part-time course. Like once you are qualified with MSc, you can do your PhD nursing. Okay, so like you can do it as a part-time course for 3 years, you can complete your PhD. So once after you finish PhD, what is the next step? Okay, so once you finish your doctorate in nursing, you will be eligible to be placed in many areas. Okay, so like you can work as your so in case if you are working in the clinical area, you can work as nurse educators, your clinical nurse practitioners, your specialty areas where you become the practitioners. Okay, so you will be the leaders of the team. And then in case if you are going to work in the teaching sides, you can become principals, vice principals, and the head of the department. Like that you will be placed according to your specialty regions. Okay, and like in case if you are doing it in the other areas of researchers, you can become researchers, leadership qualities of researchers. Like in research programs, you have lot of areas like where you can be placed in different areas of research programs. Okay, so with this, like you will get a rough idea about nursing. That is like you have different programs in nursing, your diploma program or the GNM program. Then we have the diploma or the post basic specialty programs, that is your critical care, anesthesia, ICU and all these areas. Specialty programs or 1 year training programs you have. And then comes the Bachelor of Nursing program, which is a 4-year degree course. And then we have the post basic program, that is like after finishing your GNM, you will be qualified to do post basic program if you want a degree certification. And then comes your specialty, that is your masters in nursing, where you have 5 specialty areas of medical surgical, community health nursing, pediatrics, obstetrics and gynecology, and then finally you have mental health nursing, so where you have 5 specialty region. Then advanced programs include your MPhil and PhD programs. So most probably like whatever subject or whatever specialties you have taken in your masters, that will be done as your PhD program. So here in PhD program you will be concentrating lot towards the research development and like regarding the publications of your researchers. Okay, so this is like your overall idea about your nursing program. Okay, so let us see in the next video. In case if you want any videos regarding this, you can give your comments in the comment box. Okay, see you, bye.